Around about 5 years ago, the arthritis started, and I noticed kind of a limp, not being able to put my socks on, not being able to bend properly. It sort of stops some mobility, and I don't get as much flexibility, and it's a little difficult to sort of do stuff normally. I'm a swimming instructor, and moving in water with children has become slightly more difficult, and my main concern is that things could get increasingly worse and then I'd perhaps not be able to work. Having looked into sort of NHS and private hospitals, what came out and what was apparent is that the Nuffield are using state-of-the-art equipment, state-of-the-art hip, state-of-the-art robot, and that was the main influence that I would give myself the best chance for recovery and for the operation going well. Some people have been a little bit concerned that the robot's going to do the operation. In actual fact, it's John doing the operation with the robot assisting him. The day of the operation I was quite nervous, and everybody was very supportive, and they put your mind at ease in that they've done it so many times, it's routine for them, and you really did feel you were in good hands. I felt at first that the operation was a big financial layout for myself and my family. Friends then spoke to me and said, look, you'll spend money on a car, you'll spend money on a holiday. What is wrong with you spending money on your own health? And I started to come round to the fact that this was a once-in-a-lifetime operation, and for it to be the best that it possibly could for me and the outcomes, that to spend the money was a great idea. In hospital, had I been left to my own devices, I've not bothered with much, been nervous, been frightened to put weight on the operated hip, but there are professionals there, nurses, physios, that sort of guide you and help to empower you to sort of move forward with that very early on. Now I feel as if I do movements and I take things on without even thinking twice that there's a sort of new hip or a replacement hip being put inside my body. So for me, at this 5-month stage, I do feel very confident in the hip. I felt from the very beginning that paying privately for my operation was giving myself the best chance in terms of recovery, in terms of the hip, everything about what I was trying to achieve, and that has been 100% successful in my case. And now I'm completely right at work, I'm completely right if I swim for leisure. It's a real big part of my life, as you say, my job and for fitness and exercise, and that has completely 100% helped me to achieve my goals.